My name is Pamela Blackwell. I am the Oral Health Project Director for Access for Health Action New Mexico. We are pleased to present to your committee again this session our dental therapist hygienist proposal. And dental therapist hygienists, they really are a community solution for creating access and jobs for our rural, tribal, and underserved communities. First off, in May 2013, you all might be very familiar with this report, the New Mexico Healthcare Adequacy Workforce Report found that New Mexico is 39th worst in the US in the number of dentists per 1,000 people. 69% of our dentists are in New Mexico metropolitan areas, and 1.31 million of our New Mexico residents are either in dental health provider shortage areas or in underserved areas. New Mexico needs 400 more dentists to meet this need. 9 New Mexico counties have either one or no dental hygienists or dentists. And we have 40 long-standing vacancies for dentists in New Mexico. And those are just from the communities that have asked for dentists and have not given up on that search for a dentist. As a result of this, we have 34% of our third graders have untreated dental decay. So this means thousands, in fact, 1 million plus or more of our residents, children, seniors, people with disabilities, are waiting for more than 6 months or really not ever getting dental care that they really need. They're living in pain, they're missing school and work, they have life-threatening medical emergencies and long-term health problems because, as we all know, poor oral health can lead to poor overall health. Other factors are worsening this shortage. Very few dentists include Medicaid and non-insured patients as a part of their patient mix, or as a substantial part of their patient mix. And we have an aging dentist workforce. So 51% of our current dentists are age 55 and over. And demand is only going to increase. Federal law, through the Affordable Care Act, mandates dental coverage for children up to 21 years. We have Medicaid expansion, and very recently, our Department of Health announced that the Medicaid expansion will include dental coverage for adults as well. With this New Mexico Healthcare Adequacy Workforce Report, there were some key recommendations. One of the foundations of the recommendations were that the number of dental health professionals in the state and their maldistribution cannot adequately meet current or future demand. And, quote, the report recommended, the legislature should also revisit the concept of dental therapist as an additional way to provide care to underserved areas under the supervision of dentists. Now, who are dental therapists? They are dental providers who, under general supervision of an off-site dentist, study after study showed that they provide quality, cost-effective dental services to rural and tribal communities. Zero of 1,100 studies and reports have revealed any problems with the quality of dental care that dental therapists provide. These are high-quality providers. They're also homegrown and culturally competent providers. They're selected by their communities, and they return home to serve their home communities that they know, or similar underserved communities. They obtain a rigorous competency-based education, training, and clinical experience. The key with dental therapists is with a dental therapist, you get a dentist. They are part of the dental team, and they expand the reach of dentists to these underserved and remote communities using telemedicine. In addition, dental therapists are a financially sustainable workforce model. They provide a range of billable services, routine treatment and restorative care services, as well as prevention and education. Our most recent study concludes that they cost their employers less than 30 cents for every dollar they generate when serving underserved populations. So you can, with dental therapists, provide access to underserved populations and still keep your doors open to continue to serve your patients. They can also increase dentist productivity and profitability, including adding a 20% Medicaid patient mix. Since 2005, they've provided care in remote Alaskan tribal villages, most recently in Minnesota, and over 90 years in over 53 other countries, including industrialized nations. 40,000 more Alaskans now receive routine and preventative care because of dental therapists. Dental therapists provide a workforce solution for New Mexico. Many New Mexico communities would like to have dental therapists because this is a career and job opportunity for them in these rural and underserved communities. Our legislation, of course, includes a career pathway for hygienists. So with an additional intensive period of training for registered hygienists here in New Mexico, they can also become a dental therapist. That means providers serving people even sooner. Now, the reason we have to bring legislation is because the Affordable Care Act included a section which prohibited states from having dental therapists unless state law allowed for the scope of practice of dental therapists. So this is really a tribal sovereignty issue and a community self-determination issue. We need legislation to allow these communities the right to determine how they want to serve their communities and how to solve their dental access crisis. And tribes need this to restore the tribal sovereignty to make these decisions for our tribes, pueblos, and nation. Dental therapist, it's an innovative, but it's also a tested model. Certainly we've brought the proposal for dental therapists to the state legislature from 2008, and actually perhaps sooner than that as well. We've introduced legislation in 2011. We have been heard by a number of committees since then during the interim sessions. We also introduced legislation in 2013. We do plan on introducing legislation again this year, and for this next legislative session, though we do realize it is a budget session. We have broad statewide support for our legislation in this proposal. Communities such as Kiowa, Santo Domingo Pueblo, Clayton, and others would like to have dental therapists. We also have a number of schools in New Mexico that are interested in having dental therapy programs. Those include Doña Ana Community College, Southwestern Indian Polytechnic Institute, Eastern New Mexico University Roswell, and Northern New Mexico University. We have support also from former cabinet secretaries and medical professionals as well. We have a strong and committed coalition of supporters. And we will continue to reach out to those who have opposed our proposal, and we're happy to continue to do so. But this crisis that we are facing in New Mexico that's only going to get worse is bigger than all of us, and it demands action and a solution. And we happen to have a solution to address that crisis. This solution, it will improve access to care, it will provide jobs, it will restore community self-determination rights and allow the best of our New Mexico training institutions and communities to partner to solve our dental crisis. We respectfully request this committee's endorsement of our legislation. We thank this committee for its endorsement of our legislation previously last year, and we look forward to any of your comments and questions.
Thank you. Thank you for your comments.